More than a tenth of UK care workers are being paid less than the national minimum wage of £6.50 an hour, a study suggests. The Resolution Foundation think tank says its research indicates that about 160,000 people are losing out on an average of £815 each a year. It said some firms wrongly did not pay staff when they traveled between clients, on training, or when on call. Ministers said they were taking action against employers who broke the law. The national minimum wage is paid to adults aged 21 and over, and there are lower rates for younger workers and apprentices. The minimum wage regulations say working time includes traveling in connection with work and training, or traveling to training during normal working hours. The Resolution Foundation, a not-for-profit research organization, said the problem it had uncovered was primarily down to the failure of employers to pay staff at a level that adequately covers all of their working time. The care industry sector, which employs about 1.4 million people in the UK, has long been associated with low pay, while funding cuts and an aging population is creating an additional strain on wages, it added. The Resolution Foundation said the total amount that care staff were missing out on was estimated to be about £130 million a year, but it could be higher. This is because the study did not take account of illegal deductions to pay, which it said was the most common reason for non-compliance with the minimum wage regulations. It is calling on national and local government as well as social care providers to address its concerns. Laura Gardner, a policy analyst at the Resolution Foundation, said, diminishing public funding and ever tighter commissioning practices are placing great pressure on care providers, but there is simply no excuse for breaking the law. As well as helping to attract and retain staff and boosting the incomes of low-paid workers, better pay would ultimately lead to improvements in care quality. TUC General Secretary Francis O'Grady said it was criminal that care workers were not being paid their full entitlement. Our social care system is in crisis because of huge cuts to local authority budgets, with many councils outsourcing services to the cheapest bidder, she said. Without extra funding, the care sector will continue to be a haven for zero-hours contracts and Victorian-style employment practices.